comparative effectiveness, and that's another form of sort of centralized pricing of providers. How do we compare different products between providers? And here the benefits have been sort of, I believe, sort of taken for granted that this will improve health and lower spending somehow. And this is essentially, I think, what this boils down to is essentially public subsidization, I think, of quality evidence in the healthcare markets. That is to say, the government is going to fund new evidence on quality of these products and then basically let it out in the marketplace through publishing these CER studies. What is less understood, I think, by economists is how the market's going to react to that new infusion of evidence. How are patients going to react, how are doctors going to react, how are payers going to react, whether they're public or private. And we talked about this in the Journal of Health Economics paper this year, essentially talking about what the effects of CER when it's infused into the market may be. So if you think of it as just as sort of affecting quality beliefs or effectiveness studies, effectiveness is essentially quality of a medical product. And if you have studies that generate winners and losers of comparing treatments, then presumably the winners of these studies will be perceived of higher quality than they were before, and losers will be perceived as lower quality as they were before. This will presumably generate higher demand for winners and lower demand for losers, i.e., sales of winners will take off and sales of losers in these studies will slow down. This directly implies that overall spending is ambiguous, whether the winners take off more, they may take off more in spending than the losers drop in spending. So the total aggregate spending is not clear what will happen to it if you infuse this sort of quality evidence in the market.